grafting and dental implants. Sometimes when you do a dental implants, we usually add a bone graft and sometimes a bone graft and a membrane on the dental implant. So one of the questions patients ask is, when you have enough bone to do the dental implants, why should we graft? Is grafting required? So we will be addressing that in this video. This is Dr. Arun from Pearls Dentistry, running a dental centers in Chennai, Raja, since 2001. If you have not subscribed to our channel Pearls Dentistry, please do subscribe. We are coming out with a new video every day. So when you do a dental implants, of course we do a very stringent diagnosis and treatment planning to see whether the patients can get a dental implant done. So once we do that, we actually take sometimes a CBCT, do a software analysis, do a virtual implant planning, and then ensure that how are we going to place that implant is already first decided. But once we decide that, there are some instances where after we place a dental implant, we also do a bone grafting at the same time. So in this video, we're going to look at why do we do it, what conditions necessitates us to place a dental implant. One condition is, that is usually sometimes what we do, what are called immediate implants. In immediate implant, what we do is we take out the tooth, and once we take the tooth root out, there will be some infection that is there. We clean up all the infection, we thoroughly clean the infection, and then we evaluate the socket and put the dental implant up. So in that instances, what usually happens is the size of the extraction socket will be little bigger and different in shape when compared to the shape of the dental implant. So in that case, there will be usually a gap between the dental implant and the bone that is there. There is a reason to it. What we need to understand is when we remove a teeth, be it the front teeth or the back teeth, whichever teeth that is there, once we remove the teeth, there is something called residual resorption that happens. The resorption that happens is there is a bone loss that happens over a period of time. Knowing that there is going to be a bone loss that happens over a period of time, what we usually do is when we remove a tooth and put an implant, we usually put the implant little away from the area where there is going to be a bone loss, so that the implant is well protected over a long period of time. Because to keep the implant well protected over a long period of time, what happens in the space that is there between the implant and the bone, we fill it with a bone graft. So the reason we put this bone graft is, one, there might be a future resorption which can affect the implant, and there is going to be a space between the implant and the bone to fill the space, because the extraction socket is going to be different from the implant shape and size. We do this as a bone graft. So this is one reason in which we do a dental implant, bone graft after we place a dental implant. The second commonest reason why we have to do a grafting is sometimes because we do what are called delayed implants. It means that there is already a lot of time that has elapsed between the extraction and the time in which we place the implant. Because of the time that has elapsed, there is resorption that has taken place there. When there is resorption that is taking place there is not enough bone to fully cover the dental implants, in all the three dimensions. Because there are not enough bone to fully cover the dental implants, here in this case what we do, we place the implant, and to ensure that the implants are well encompassed in the bone, we place a graft, and to hold the graft and to prevent any gum tissue to grow into the grafted side, we place what is called a membrane also, and then we close the gums. So this is one of the instances where we place a dental implant and then add a graft. So these are the two commonest reasons. And so whenever there is a bone that has got resorbed over a period of time, for various reasons, it can be because of infections also, we always do a grafting and then do a membrane also. So hope we answered these questions, why a grafting and a membrane might be needed when you do a dental implant. If you have any other questions, please do ask in the comment section below. We will be happy to answer. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.
Press the like button, do subscribe and click on the bell icon to receive such videos. Thank you.